My lawyers can hash it out. I will not inconvenience you any more than absolutely necessary. But it'll be toward the end of the, or let's say, yeah, we'll just see how far we get. So remember, the general idea here is that the kidneys are endocrine tissues to the extent that they're releasing a hormone, at least several hormones, including renin. Renin is, for example, released in response to reduced blood pressure. The reduced blood pressure may reflect reduced total body water, may reflect hypovolemia, and so on. So what would be the endocrine compensation resulting from the release of renin? Well, we said renin, through a series of reactions, angiotensin converting enzyme converts angiotensin 1 to angiotensin 2, you get the following compensatory responses. And again, I must have loaded the wrong slides again, but because I see some changes here. But anyway, in any case, there are going to be systemic changes and renal changes. So make sure you understand how these changes are broken down here, systemic and renal. Systemically, angiotensin 2 will increase thirst. That will increase, hopefully will increase total body water. They will induce vasoconstriction. We know that peripheral vasoconstriction will also elevate blood pressure. Angiotensin 2, it says stimulates cardiac vascular hypertrophy. That just means that cardiac output is being increased. The cardiac output will also tend to elevate blood pressure. Again, if there's a compensation, let's say the patient has gone into some type of circulatory shock resulting from blood loss, well, this would be a temporary, at least short-term compensation for the reduction in blood pressure. And then this would also lend toward sympathetic activation. You know, sympathetic activation is also going to increase heart rate, increase contractility, and induce peripheral vasoconstriction. So all of these are systemic responses. Locally in the kidney, again, this compensation for reduced blood pressure. There will be constriction of the afferent arteriole. What on earth would that have to do with systemic blood pressure? Constriction of the afferent arteriole. What are we doing there? Well, that's true, but more importantly, and that's what the idea that we're also diverting blood away from the kidneys toward the general circulation, thereby elevating blood pressure. And notice the kidneys also promote release of aldosterone and ADH. We'll talk more about aldosterone. But aldosterone primarily acts upon sodium transporters. So as we finish this little topic, you should be, if all of this is achieved by angiotensin converting enzyme when it generates angiotensin 2, what would an ACE inhibitor do? All right, it's going to counter each of these processes. So all of these are intended to elevate blood pressure. An ACE inhibitor then would generally act to lower blood pressure. So just be sure you understand the relationship there. Now, here we're looking at the general pathway. Here's renin released from the kidney. You can see the angiotensinogen being converted to angiotensin 1 and then angiotensin 2. Angiotensin 2 is then going to, among its many effects, is going to promote release of aldosterone from the adrenal cortex. We've already talked about the mineralocorticoid aldosterone in our discussion of adrenal physiology. But what I want you to pay attention to here is the mechanism. You've already indicated that aldosterone is a steroid hormone. Here's our renal epithelium. That's our tubule there. Where are the receptors for aldosterone? Intracellular. All right, so make sure, big difference here, the steroid binding intracellularly. And I'll admit it gets kind of cryptic over here, but the general idea, if you'll notice, we have sodium coming into the cell over here, sodium coming into the cell over here. This is secondary active transport of both hydrogen out and potassium in, but the net effect of all of this is to increase the movement of sodium ions into the out of the lumen and into the blood. So remember, this is critical in as much as we increase the concentration of sodium, then the water will follow. So this would be another mechanism for retaining or conserving water in the body. So both ADH and aldosterone act to conserve water, chiefly in the distal tubule and collecting duct. A and P goes by a variety of names, but A and P is the only one of these hormones that actually acts in a opposite fashion. So A and P is released from the atrial wall, the heart atrial wall, in response to distension of the atrium. And notice its effects there. So A and P inhibits sodium reabsorption, inhibits ADH production, and increases urine volume. So A and P is going to have what effect? If it increases urine volume, it's acting as a diuretic, and what's that going to do to blood pressure? Lower it arm. And then you have several illustrations here explaining ADH, ANH, and renin, the RAAS pathway, bringing them all together and how they contribute to regulation of renal throughput, renal regulation of water. So I'll let you work through those if you need to. In fact, the same thing here. This is just a discussion of the RAS pathway and its ability to regulate either low or high blood pressure. Well, you already know the definition of tubular secretion. Secretion refers to the chiefly active transport of substances, oftentimes toxins, basically anything that the renal epithelials feel are not natural or not normal to that system. The active transport of substances from the peritubular blood into the tubule lumen. And we've indicated that a number of critical substances, critical from your perspective, are transported in this fashion, all contributing to the ability of the kidneys to clear toxic or undesirable substances from the blood. Hydrogen ions, this is what we're going to talk about in our conclusion here. Hydrogen ions, also potassium ions, but also things such as penicillin, antibiotics, a lot of drugs, certain neurotransmitter medications, for example, all would be secreted, and that can present a bit of a problem for you. And we talked about PAH. We don't need to get into details here. Some are provided. Remember, what proportion of anything is going to be filtered? Anything coming into the afferent arteriole, what proportion at any given time is going to be filtered? Yeah, it's about 20%. So just keep in mind that filtration is not overwhelming to begin with. And then if you have something that maybe 10 or 20%, because there are a lot of selective mechanisms that regulate the extent to which some substances are filtered. If something is only filtered, let's say the 10% rate, ends up going back over here and then is virtually entirely secreted, well then almost all of it is going to end up in the urine rather than remain in the blood. pH would be one such substance. So you have pH coming into the kidneys here and virtually nothing coming out. Where does it all go? Into the wastebasket. Clearance. And again, this is just an illustration reminding you at the cellular level what's going on in clearance. We're going from the blood across those endothelial membranes, capillary endothelium, interstitium, epithelial transport across the renal epithelial cell into the lumen of the tubule. Now in this illustration, or in this graphic, we're looking at both the proximal tubule and the distal tubule. It really doesn't matter which one we look at here. Let's focus on this one over here on the left. This is familiar to you. What is that? What reaction are we looking at right here? The carbonic anhydrase reaction, which you know from your active study of European history. Right? So there's the carbonic anhydrase reaction, and as long as there's plenty of CO2 coming in, what will be generated? Hydrogen ions and bicarbonate. We saw this in the GI tract, we saw it in the lungs. All right, so as long as CO2 is driving this reaction, this carbonic anhydrase reaction, we're going to get these two products. And where do they end up? By what transporters in the renal epithelium? Notice that hydrogen is taken into the tubule lumen, and what happens to the bicarbonate? It goes into the blood. So what we're going to find, and this is what I want you to get from this graphic, in both the proximal and distal tubules, is the kidneys play a very important role in regulating blood pH. by removing hydrogen ions and discharging bicarbonate ions, which are basic. As you look at the little graphic here, the pink is secretion. We've already talked about reabsorption. You know that everything everything in the cosmos, everything in the universe is reabsorbed, right? That's our general argument. But notice what is secreted. Proximally, hydrogen ions, products of nitrogen metabolism. Yeah, urea, uric acid, creatine in this illustration. I should say creatinine. And ammonium, and some drugs, right? That's going to be proximally urea. We talked about urea getting caught up in here. And then what is secreted distally? Again, hydrogen ions into the urine, potassium ions, because they tend to work together, and that's what that thing is all about. As the pH of the blood drops, there's a tendency toward hyperkalemia. We won't worry about that too much in here, but I do want you to notice that what are the distal substances that are most actively secreted? Again, acid, potassium, and the products of nitrogen metabolism, ammonium. So that means these are being taken out of the body into the urine. Same thing here. Approximately, again, this is where it's going to be a problem for you as a PA. A number of drugs are going to be secreted proximally, and you're going to have to take that into consideration when you calculate your dosages. But also some neurotransmitters. Generally, these should not be at high concentration in the kidney anyway. We talked about diuretics. Do you know what diuresis means? This is just urination. So we talked about loop diuretics. Loop diuretics act. What percentage of water reabsorption did we say occurs in the loop of Henle? Remember in that little picture we looked at before? 15. About 15%. So there are a number of mechanisms by which these loop diuretics work, but they're going to affect at least a portion of that 15%. And we've already talked about the ACE inhibitors, right? We talked about how these are inhibiting that ability to generate angiotensin II, which acts to elevate blood pressure. And then, of course, this is just a list of things that should not be in the blood. Oh, sorry, should be in the blood. Should not be in the urine. High concentrations of protein. Albumin is the most abundant protein in the blood. So, albuminuria. Anybody else want to give that one a try? Albuminuria is often indicative of some type of renal pathology. Of course, glucose would be indicative of potentially, diabetes potentially. Shouldn't say any red or white blood cells. One might be an indication of a filtration issue, the other perhaps of an infection. Ketones also, because the body is turned to can't metabolize sugars, which it's relying upon fat tissue, so the ketones may be indicative also of diabetes. Bilirubin in high concentrations. Some of the products of red blood cell metabolism are responsible for coloration, for example, of the urine, but excessive amounts of bilirubin would be possibly indicative of pathology, and then of course bacteria. Is the urine sterile? Huh? Well, that's a heck of a qualification. Is the urine sterile? What have you been told? It's not. Yeah. I'll let you research that if you want to. Louis said it best. He said, what did you say?
In the bladder, for the most part.
For the most part, for the most part, that's true. But a lot of the fluids we thought were sterile, if you read the textbooks, are sterile, in many cases not. And of course, you need to memorize this for the test. No, you don't need to. You don't need to memorize this. But what this is telling us, and I hope you can infer, renal problems affect every system in the body. Cardiovascular system, you just go right down the list. The neuromuscular system, the endocrine system, everything is influenced by renal function. Very, very critical. If your patients are in renal peril, that needs to be addressed as rapidly as possible. All right, if you give me just a few more minutes, I'm going to summarize this in the following way, and then we'll be finished. This should only take a few minutes. If not, I'll stop anyway. All right, so we had a graphic a moment ago that showed that the kidneys play a very important role in regulating blood pH. All right, you already know that if your patient comes to you hyperventilating, that may be an indication of what? Why is that patient hyperventilating? They're just happy to see you. Why are they hyperventilating? Huh? What? We had that little graph earlier. We had a little figure. You had alveolar ventilation. You had oxygen levels and CO2 levels. What would that have to do with hyperventilation? What are they trying to get rid of the get out of the body as efficiently as possible? Yeah, CO2. All right. So if the CO2 is elevated, that might be the cause of acidosis or low blood pH. All right. And so here's the thing that students foul up on the test most of the time. Make sure you don't confuse the response with the cause. So that patient is breathing or hyperventilating for what reason?
Compensation.
All right, the breathing is compensation for what? You're exactly right. Compensation for?
Acidosis.
Oh, yeah, acidosis. All right. And it doesn't work this way well in practice, but in theory, if the blood were alkalotic, what could the patient do to compensate? Yeah, hypo. Yeah, it doesn't work that way, but I just want you to see. So ventilation is a very important compensatory mechanism for acidosis or alkalosis. But the kidneys also compensate a little more slowly. And how do they do that? Kidneys have the ability, as we saw just a moment ago, to pump hydrogen ions into the urine and pump and reabsorb bicarbonate back into the blood. And in so doing, the pH of the blood is elevated. Now, you're going to learn about the symptoms of acidosis and alkalosis later, but I do want you to be familiar with this triumvirate. The pH of the blood has to be exquisitely regulated. You can see right in here, about 7.4 or so. If it's not in that range, if it gets too high, that can be bad news, and if it gets too low, this doesn't seem very encouraging to me. So there are three mechanisms by which blood pressure is regulated: by means of blood buffers. These are just substances that soak up, sponge up hydrogen ions, for example. By the respiratory system, as we've already talked about, ventilation to compensate for elevated, hypercapnia. Remember we talked about hypercapnia. And then the urinary system, we're calling this renal compensation or metabolic compensation, renal or metabolic compensation. So here's a list of buffers, the three primary buffers, the proteins, the phosphate, but this is the one we're focusing on right here. We're most concerned about the bicarbonate buffer system, and you already know how it works. CO2 and water spontaneously generate bicarbonate and acid. And I want you to be familiar then with the concept of either respiratory acidosis or alkalosis and metabolic acidosis or alkalosis. Respiratory acidosis results from the accumulation of CO2. Basically, the lungs aren't doing the job. CO2 is developing. You have that we talked about hypoventilatory hypercapnia, right? Now, these numbers, what's the normal PCO2? What's a typical PCO2 blood returning to the lungs? I'm sorry, blood leaving the lungs. What would be the typical CO2 we talked about before? We had 40. So we're going to say this is a normal range, 35 to 45. It's a normal range. And let's say that the level of bicarbonate as generated by the kidneys is going to be around 24. So we'll say 22 to 26. 22 to 26. So here's the deal. If bicarbonate levels drop below 22, is the blood going to become more acidic or less acidic? More acidic, because this is a base. By contrast, if carbon dioxide levels in the blood increase, does the blood become more acidic or less acidic? More acidic. So these are inversely related. Does everybody see that? An excess of bicarbonate elevates the pH. An excess of carbon dioxide lowers the pH. So what I want you to be able to do, we'll just finish with one of these just so we can say that we're familiar with the concept. You help me out here. Patient's blood is 7.3. Is that good or bad? Is it acidic or basic? All right. Let's remember those numbers: 40 for the carbon dioxide and 24 for the bicarbonate. All right, let's look at the next number here. PCO2 is 25. Is that good or bad? Is that normal or abnormal? All right. Is it too low or too high? Too low. All right. Bicarbonate levels. What should it be? Yeah, somewhere in this range. So it's too low. So patient is acidotic. What is the cause? Is the cause resulting from the lungs or the kidneys? Kidneys. Everybody see that? Why do we rule out the lungs? Because if the lungs were responsible, the deviation would be in the opposite direction. It'd be over 45 or so. Everybody see that? So the cause is the kidneys. Are the lungs compensating? Is the breathing of the patient, is the CO2 of the breathing altered sufficiently so that the patient would be in compensation? Is the patient trying to compensate with their breathing for the metabolic acidosis? All right. And we know that because, again, this level is so low. So I just want you to be aware of these concepts right here: respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. The cause is always, in the very simple problem that I might give you, such as these, you'll get, help me out. pH is too low. Why? Tell me why here. What's the cause of the low pH?
Elevated CO2.
All right. So this would be respiratory or metabolic acidosis? Respiratory. Is the bicarbonate level abnormal?
Yeah.
So is there or is there not compensation here? All right. Everybody see how we did that? Yeah.
But they're not completely compensated.
It's partially.
That's right. This is just well, they're not going to be completely compensated. In reality, you're going to have some cases where both may be responsible. Yeah, I just want you to understand the concepts here. You're exactly right. Yes.
Is the cause determined by the greatest deviation?
No, it's going to be in the problem that I will give you. Only one of these will be consistent with the pH. And so the only other thing you have to do is let me know if there's compensation by the other system. What's the cause over here? What's the cause of the acidosis here? Is it the lungs or the kidneys?
Metabolic.
It's metabolic, so it's kidneys. Is there compensation? Not much. No, not going to any compensation here. All right, you have some time. If this is not clear to you, I'll be happy to discuss this with you in the individually. I think there's some practice problems in this unit after it. There are also some GFR practice problems, but that's it. So that's what we need to know for the test. I apologize for keeping you. But if you will, let's reconvene over in the computer room then. Do not use the lockdown monitor.
So bargy.
All right, you got this, Alice. you think? Beth? It's over. It's good.
I knew most of it.
Yeah.
I think I got them right.
Same.
Did you put broad ligament for the
Yeah.
one? For like, it was
That's the
like
only one I was thinking about, so
underneath?
yeah. You put gastromental, right? So I was looking for a bit closer.
Yeah.
But it's the same.
Well, yeah, I think it's the same
Same.
thing.
What was that artery sitting right below the stomach?
I don't know, I put the gastromental.
That's what I put, but is that the answer?
I think so.
Yeah, it is. It's the same as the epiglottic or the gastro
Okay,
and
yeah.
phloic.
And it's the
That's
same
what it
name?
said in,
It's the same name.
Oh, okay. I was like, because I don't remember reading that.
Yeah, it's not the left
I was
gastro.
trying to figure out what epic fluid meant, right?
I was like, get a plug, and then he was like gastromental, and I was like, I mean, it comes where it is, kind of.
Thing.
I know. I
You
really
guys
don't
do that yet?
know.
It's just so annoying. I did it in class yesterday. Because it takes every slide in 10 seconds to stay on top.
Just gonna like listen to some fucking music.
It's just like annoying to have to do that.
The public has to do
We're gonna be
it.
doing HIPAA stuff for the rest of our fucking lives.
Started working in healthcare like 2 years ago. I've already done it like 8 times.
Done that same one?
Well,
Yeah, I've done it a couple times too.
That's specific to Nova, but still.
Where? How do you print things? I've never
You print them at the computers in the lab.
You should put in your password like 6,000 times. Alright, so I'm done for the day.
It's Cody. It's Cody. He was so close.
I saw it for a second. I was like, I'm there. Bamboozled by the Vegas.
Page 1.
I can't believe I switched that
Did you
stupid
send me
recto.
the link
No.
for,
Recto and vesico.
Oh,
I got flipped. So first I picked recto. I went back and went, I thought recto was under, so I changed it.
Oh.
Yeah.
I mean, it's using the same point as your
That one of
for,
the
make a whole nest.
sagittal cut, it was just showing up top. That was uterus, right?
Yeah.
Cool. So, I mean, I'm assuming people would like it once they do it.
So I'm probably bringing it.
Dude,
Yeah.
killed it. So like common hepatic surgery? Yeah, that was good. I told you. Should be better with you.
Go by,
Gastromental.
because then you can like sit down, and, like still like, not like, sitting like. That's my
Yeah, they got it locked.
That was a picture.
Or I got the questions last. Come on, man, the last one. I was gonna fight you.
I was kind of thinking around like it's extensive.
I have to go do
Is there another? Yeah, go through the pictures.
That was it round or broad?
I don't know. I thought.
every day.
I didn't know that.
So you, Ty, you almost had to open lunch.
No, the way he explained it.
I was like, hey, I can't believe that only Harder even called it. Yeah, that was good.
I asked him.
Hey Bob, do you know where we're gonna be able when we're gonna be able to see our grades?
I do not know when. You mean for the quiz?
Yeah.
I asked him. I was hoping that he just forgot, and I asked him. I said, "Hey, the grades weren't available," and he said, "Oh, they shouldn't be." I'm like, "Okay, just checking."
Oh.
In Ackland, something called the right gastro. Oh, that's yeah, that's right. Remember when you was at the project? Wait. It was Vegas. Oh, it was Vegas. Oh,
Dude, he was on there too. He was on there. If you would have said two instead of one.
Oh, so close. I'm more excited about that.
I was more concerned about the What was it was labeled as two.
But that was
He didn't include it as piece, but it wasn't. We sent the return already.
Do you need anything for a project, or help, or any? I mean, I don't like during our project. Did Black people eat ham?
Yeah, we did it.
Oh, good. Mom's great. You need what? I don't know. I'll tell you what. I'll get drinks. I will get. Should I just get some water? Just get some waters? Really? Will anyone drink it? I mean, I know it's called.
Did you leave one of these in my house?
Did I?
It's like one with blue inside. You have one with blue. I don't recognize the bottle.
I don't think so, but.
No? Okay. So what's the plan today?
We have them. I mean, we don't have to do anything. Do you have to do your history tagging today?
Tomorrow. But we can practice, do one very quick. And we gotta do HIPAA bullshit. Oh, you did that? Oh, yeah. We need to start doing the. Shit, I put it wrong. They look the same. We need to start studying physio. It scares me. You're studying here at home?
I don't know what I'm going to do, actually.
That was when I was
You guys going for lunch? Huh? Louis?
because I read it again.
About how much do you questions? What one?
Hey, where you guys going for lunch? Shit.
It's so good though, but I can't.
No. I'm looking at exercise this week. I gotta
You can't ride on it.
I've been doing better.
We'll do it all the way.
Yeah. The one we have access to. Yeah, I had it down. The easy one. I had it down so good. I for sure want to buy that. It's not that. Oh yeah. I heard that one's pretty solid.
Hey, Cut. Where you going?
I saw you. You texting to Brazil
Well, I'm not going to Brazil.
No,
Just bring me the check.
Well, not yet. I've next time. Oh, right? Yeah. That's how we plan It's so close, dude. I saw it. Do you want to do history taking at some point? We don't have to do that. Oh, you first? Yeah. You have one? Yeah. Nice.
Very mighty neck Great practice. And then my sleigh carries toys and so reindeer like my sleigh, and that's for the Mary children's backpack. My sleigh carries toys and eggnog, so reindeer yeah, that's all. They have like 2 more nowadays, has like one going this way, one going that way. I like really big one, and it was like that's the photo vein. I found it superior mesenteric, one inferior mesenteric, and one's bleeding vein. How many packages of arteries? How many packages are you doing? Then your splenic goes up, or your splenic goes here, and your celiac goes here. Do you want to come here? Text me to 10 minutes. Bam! Fired it off. Yes, your forehead vein, your splenic vein, your inferior bottoms are your
I'm doing it. It takes forever to open it. Yeah, I'm clicking over now.
Yeah,
Did I cover it?
I think 1 minute.
Yeah, it's only like over half.
Have you done all 3? Yeah. Second, third, like an hour and a half. Just number 2.
No, the second one was shorter because they're all. Oh, no, I don't think so. I think the first one was longer.
It was just hand.
I know. Do you?
I don't know why they did it.
I'm just guessing and then I'll take the answers. Yeah, no, but you can take the quiz over.
Well, it says it
Really,
really.
I don't know. Do you want to copy it all?
Give me a second. Give me a second.
I thought you were going to say lady or
I was
lady.
gonna say lady, but then you're sitting there too.
She's like by the.
Alright. Trying to do this.
Alright, what are we doing about that?
Are you guys eating?
Okay. Not feeling good? Okay. Okay. Well, I did. So, what are you doing right now? Doing this thing.
I actually.
Oh.
There's no way that you want to choose to really debate two for ovaries. Yeah. It's like you kind of break it.
See the
Preseason, maybe. You ready?
yeah. Did you see the manuscript for the whole appeal that got released?
I haven't looked at
How bullshit everything is? Like
it.
literally,
You like that picture I sent
yeah, except for the fact that Brady Kitchen over what they wanted. And Ted Wells was like, no. Ted Wells was like, no, you won't get in trouble for turning over, for not turning over your phone. You turned over what you needed. And then of course, they get him for, man, I hate Roger Kelly. Seriously. He's awful.
He's so bad.
Cody, how are you on head yourself?
Not good at all. That's why.
All right. Well, I want to go home and eat. Are you gonna be here? Did you want to
I
practice
gotta do
until
my
later?
I gotta do my history team tomorrow.
All right, that's fine. I'm gonna come back probably like, and I want to practice some of that stuff.
I
don't know if
I
you
go
can-
at 1:15.
Okay. Yeah, he's probably just out there. What about you, Smart?
What?
Have you been practicing yet?
A little bit. I did it yesterday. I might go over it again today.
Well, let me know, because I want to go over it too.
Okay, yeah. Are you staying here late tonight or later today?
Yeah, I'm gonna go eat now, and I'll probably study a little bit at home, and then just come back later.
Yeah, I'm gonna doing the HIPAA thing now.
Okay.
Then gonna go to the gym, go to the grocery store. Gotta get.
Well, you got my number, right?
Yeah,
Shoot me a
yeah,
text.
shoot you a text.
Because I mean, I can't really.
I'm gonna come back
practice.
here later tonight.
Yeah.
My goal is to be back here studying by like 3 or 4.
Okay. Well, it's not really tonight.
Well, I mean like maybe 4 or 5, somewhere around that time.
No, because I can't really practice head until by myself.
Yeah.
And if you've gone through it, I've gone through it like yesterday and then some other times with Cody a little bit.
Yeah.
So I want to be able to like get that shit out. So that this weekend, all I have to really do is touch up on that and focus all on anatomy and phys, man.
Yeah.
See ya.
One of my good PA friends.
All right, I'll see you home.
One of my good PA friends.
Sorry.
One of my good PA friends is a hardcore Patriots fan too. So he takes it. I was like, that's pretty good.
I'm so mad that we have to come here at 8 o'clock or 9 o'clock, whatever, 8 o'clock every Friday.
Yep. What?
Originally, she said that we were only gonna come and like set up the projects at 9 and then finish it at 10.
Like I don't understand what. I don't understand.
Sorry guys, I know you're talking.
What is it?
He's trying to get me to do a deal with him. He has Foster in one of the leagues.
Keep really up to him.
He's trying to get me like I just gave up one of my teams. So I was like, somebody out of nowhere, the commissioner texted me. He's like, hey, you guys don't want your team down here in school.
Evan, how you feeling, man?
I mean, I'm the only person I have on my team.
Good, let's go eat some lunch and
I want 200 shite. We have $200 budget on
here.
and I actually like it because especially for like keepers and stuff, you can get like cheap keepers. Like I got Josh Gordon because I ended up trading him before like his last year's suspension. I got him for like $2 and he was a great keeper. But like everyone's like, oh, the suspension is probably coming. You know, well, we wanted him, but then I ended up trading for Dan Bryan.
Who the hell did that?
All right.
League with a bunch of idiots?
No, he didn't want. He wasn't gonna use him as a keeper, and he was already mad.
Dennis Bryant, you're not gonna use as a keeper?
He was like, he was gonna be like $40. Something like that. You don't want to use him. He had Eddie Lacy for like 12, and Mike Evans for like 2 or 3. So like we only keep 2 keepers. So like mathematically, number wise, it makes sense. So I might keep Dennis Bryant for it's $43 out of a $200 auction.
Oh yeah, man, you gotta keep
him and then Antonio Brown.
He's arguably a top 3.
I think I'm gonna keep him. I'm definitely gonna keep Antonio Brown for 37. So I got to pick up for 27 last year.
How old is he? He's 30.
Antonio Brown.
He's
He's young. He's only like he's like 3rd or 4th year in the league.
So my PA friend, he's an older PA, and he said he needs Stewart because he lost Lobster. He's gonna lose Lobster.
Yeah.
So he wants Stewart. He wants the dog, so I had him. And he's like, he offered me like a 2016 first round pick and something. And he said, what gets this deal done? I said, write me a script, bro. He's like, all right, deal. But he can't write that because it's a controlled substance.
Yeah.
But
I'm thinking about it whether I should trade him or not.
because where did he offer me? He offered me. Oh, so this is a little bit. A 2016 first, Michael Floyd and Chris Ivory for Forte and Torrey Smith.
You're getting Forte? Or
No, he's got Forte. I know, but
unless you think
a first, and that's why I said I'm a Jets fan, but I like Ivory. So
Ivory sucks.
I mean, he's a starter, yes.
But they aren't the Jets of the old, but they would just pound the rock and be able to do it effectively.
Yeah.
I would want a little more, especially with Forte. Even though Trestman's gone, he's still really good, even though he's approaching 30.
One of my leagues I was debating because I have a 12 keeper league, and I was tossing up between Greg Olson and Dwayne Allen. I know Dwayne Allen, there's a lot of people to throw to in Indy.
Yeah.
But he is such an upset thing. I ended up keeping Greg Olson.
Greg Olson is also, he's really good. I love him. I've had him the last 2 years, and he's been like such an underrated.
Yeah.
Like even though he's not in the tier of like Jimmy Graham and Gronk.
It'll be interesting to see how Jimmy Graham does.
There was only 3 wide receivers that had posted multiple. I think it was like more than like 3 or 4 100-yard games. Go Olsen, Gronk, and Delaney Walker last year. Yeah, he's Titans. So yeah, there's a downside because what's it called? Marcus Mariota may or may not start the offensive line.
I feel bad for Tampa. I don't think what's his name's
Who?
Winston.
Yeah, he's already.
There are no good quarterbacks. When was the last good quarterback we won in Tampa for like right out of college? Never. I think the last good quarterback they had was Jim Garcia. He was old as hell. I mean, freaking how big was everybody on what's his name? The last quarterback they traded to the Vikings. Yeah. And man, he was terrible. I went and watched a Jets team against Tampa. Their first down of the game was in the 3rd quarter, and it was off of one of our penalties.
They're so bad.
I mean, the Jets are terrible.
Oh, because you come in okay, no, then I gotta go.
I think with the team that we have this year, I think we could probably sneak into a wild card spot. If we play well.
Yeah. Well, what's his name? What's going to happen to Richardson, Sean Richardson?
Yeah, that's
gonna be a huge blow.
That's gonna be a big blow. But our defense is pretty legit, though, dude. Probably. I would definitely say our defense is top 5.
Definitely.
Yeah, I would definitely say our defense is probably behind. There's so many question marks in our offense. How is Gino gonna play? How's Brandon Marshall gonna adjust?
Is he gonna? It all really comes down to quarterback, really, for the Jets. Like,
Andrew Luck.
not on the Jets.
You want to?
No, ya no, es esta está un poco. Have to sit here for.
Okay. Okay.
No, you have to sit here for.
The water bottle?
Oh.
The whole thing?
Yeah. Okay, I got some. You want? You need one?
God, my team, I have such a freaking good team. That's one thing. Until, what's his name went to the Dolphins. Until, no Sean went to the Dolphins. And he just screwed it.
Do you want to write some down? Timing?
Yeah. Oh, and then you can go, like the reservation.
Okay.
That's how we did it. That's how we did it.
Okay, I don't know.
Because you got, because I listened to you, but I didn't turn on the replay. And I just kept asking this.
Okay, let me think of something that I want to be a revelation. Okay, so you walk in here and be like this, you get 2 minutes to do that.
Okay.
I have I'd say it's like more on my, it's like a back. It's sharp, it's definitely sharp.
Okay, when did it started?
I'd say probably about 2 days ago.
Okay, and does it move, stays there?
It like radiates to the front and down.
Okay. And on a 1 to 10 scale, what do you?
I put it like a 7.
Okay, how long, I mean, does it stay there the whole time? It goes back and forth? How long does it last?
It's not constant. It only happens on specific points.
Okay, and what were you doing when that happened?
The pain is worse when I find myself using the restroom.
Okay. But what were you doing when that happened?
I was peeing.
They were peeing, alright. Okay, and then what makes it better?
I feel like it's not as bad if I stay well hydrated during the day, but it's still there.
Okay. Alright. Where the pain was, but that's okay. I can move around. Alright, so I see it's in the back. Okay. So are you having a lot of urination?
It hasn't really changed. Not the frequency hasn't changed, but the amount I get, like less.
So it's peeing, okay. Any blood in the urine?
Possibly, yeah. My urine's a little discolored.
Urine, okay. And a lot of thirsty? Are you thirsty a lot?
I find, yeah.
Yeah, okay. I'm lucky fish. Alright, so have you had any past medical issues in the past medical roles?
I've had a couple. I get constant nosebleeds. I've had some urinary infections before.
Okay. Right. Any past childhood illnesses?
I did have the chickenpox.
Okay. Have you been keeping up with all your checkups, like routine checkups, like prostate,
No.
pap smear, all that stuff? Alright, good. Let's keep doing that. Alright, any past surgical history?
No.
No, okay. Chemo, okay. Are you currently taking any medications?
I currently take some vitamins. I also take supplementary calcium pills.
Okay.
And
How
fish
often?
oil.
Okay. How often do you take them?
I try to take two calcium pills a day. They are 500 milligrams each. And I try to take 2 fish oils, those are 1,000 milligrams each.
Awesome. Good job. Oh, allergies, okay. Any allergies to any medications, food, or the environment?
No.
No? Okay. You sure?
I guess I can make one. Actually, Julie, I'm allergic to Irish
What's
Spring.
Irish Spring.
the plan for studying this weekend?
Will you soak yourself?
I know no
I
one was
feel
here
like
for
you're
this
really
much on
cheating.
AAT. I missed part of it last weekend.
Alright, so
Have
tell
one
me
reason to
about
play
yourself.
biking.
Are you married?
I'm gonna study
No.
speaker most of the weekend probably.
Yes.
Okay, you have any kids?
No.
Try to get anatomy done.
Work, go to school.
Finish
I do
anatomy
work
today,
and I go to
kind
school.
of ish, like
Okay,
the
what's the
first
level of
time.
education?
I'm a master's.
Good. Do you drink?
Go kind of
smoke,
do abbreviated rapid fire
You
type
want to ask
thing. Just kind of go.
Like, do we want to try
No,
for
I
that
don't
Sunday
think
again?
so.
Or?
Maybe Sunday. I'm not gonna finish
Socially trained
anatomy
very,
until
very occasionally, not very
Monday or
often.
Tuesday.
Yeah, I'm gonna go through the first set of stuff we got, but I'm
Probably like once every 2 weeks.
Yeah, I'm not too worried about the,
I don't know, a couple
trying to
glasses of
think
wine.
Cool. And what are your
Yeah,
daily
I'm gonna-
activities?
Sunday I'm gonna
I go to
probably
class.
head to toe a little
I
bit
work
more
out
just
at the
to go on Monday.
gym.
Yeah, we can do like, I think that's what we should focus on practical work with each other, more than anything.
Yeah, I'm gonna go over like every day basically this week versus this week,
No?
just to kind of keep it.
Are you,
So
do you
try to
feel
do
safe
it.
at home? Do you feel threatened? Anything like that?
I
feel
am
safe?
just.
Good. Are you stressed out by anything?
You want to
Sure,
get
you're going to school. You told me
Oh,
you
stressed out. I was also, yes, I'm stressed out. Really stressed out.
Good,
It's a good
good.
switch.
I mean, not because you're stressed out, but you're good that you're stressed
Yeah.
out.
It's a great
Alright,
switch.
I'm gonna do it now. I think I'm missing something. Alright, so tell me about your family.
Which, they are grades posted?
Fine.
I just know. So family,
I didn't say anything. I knew it was wrong, but I put it down. I'm like, I told myself I'm not going to change things anymore. Just in case I am right. It was more of a pride decision than the intelligence.
I do, I have 3 brothers and
now let's move on to the general survey. Have you had any recent weight loss gain? Fevers, nausea,
I do, I get.
Contigo?
You
Contigo?
want to ask what it is, or let me answer?
Oh no, I'm gonna just die after.
I get some fevers and I get chills every once in a while. I don't find myself having any.
What?
Cody's, I think.
Cool. How about your skin? Have you noticed any rashes, bumps?
Oh yeah, cases.
Any discoloration?
Ours is more.
Sores?
Cody?
Changing your nails?
Good.
No? Okay. Good. Alright, how about your head? Have you had any recent trauma? No. Any headaches?
Lots of them.
Okay. Where are they at?
They're mostly in the frontal area.
Frontal area. Okay. How often do they happen?
Every day.
How long does it last?
Until I drink some coffee.
Cool. And do they have any nausea or vomiting associated with it?
Yeah.
How about your eyes? Do you wear any glasses or contacts?
I do have contacts.
Alright. And have you noticed any loss of vision?
No.
No itchiness or hearing? Good. When was your last eye examination?
Last year.
Okay, that counts in your eye. Alright, how about your ears? Do you wear any hearing aids? Can you hear me well?
No hearing aid.
No. Any tinnitus, loss of hearing?
No.
Any ear discharge or earaches? No. Good. Alright. Next, how about your nose? Have you noticed any allergies? Any itching? Any runny nose? stuffiness? Okay. How about your throat? Any hoarseness? No. You wear dentures? Yeah. Oh, good. All right. When was your last dental examination?
Within the last 7 months.
Any bleeding gums? Okay. How about your neck? Do you notice any swelling, any gland swelling?
No.
Any stiffness?
No.
Swelling of the glands, stiffness.
What's usually associated with stiffness? If your neck is
Pain?
stiff, yeah.
The whole thing of any neck pain, stiffness, lumps. How about your breast? Have you noticed any skin changes? Any nipple discharge, lumps, masses? Any pain? Respiratory. Are you having any shortness of breath, coughing, wheezing, any sputum? Chest pain? Any no chest pain? Did chest
It's cardiac.
No, I mean respiratory.
I know, chest pain is cardiac.
Oh, okay. So shortness of breath, wheezing, coughing, sputum, bronchitis, pneumonia, COPD. Did I get?
Well, if I'm coughing, well, you got more than that, so that's all right. But if I'm coughing, what is this last?
Do you need to go through this at all? The
If I'm
HBI?
not
Pneumonia.
coughing, well,
Do you
if
need to
I'm
go
not
through the
coughing,
HBI or
that's
anything?
when I cough.
Oh, but
Okay.
Okay. So the mouth is
Well, do you take the quiz at the end of all three?
All right.
Or you take it in
So
three
let's
quizzes?
move to the cardiology assessment.
You finished each section?
Chest pain.
Okay, well, what's the one quiz?
Heart
One section.
Heart murmurs.
You go back to the website, it should automatically.
Hypertension or high blood pressure.
I'm just kind of saying no to everything.
Oh, no, that's fine.
Just so you can hit the thing.
Okay, so, but if I'm hitting it, you can
Go to.
if I'm not, then just press stop.
Yeah.
Okay.
Do I have to
So,
close
we move
this
to
first?
peripheral vascular, so.
That one you're not missing that.
Now,
There you go.
Did it in your mouth.
So,
The first
cardiac.
two are super,
Okay,
like,
one was your
easy.
last EKG,
The third one
chest
was
X-ray.
tricky.
That was chest X-ray.
Took
One
me
was
back to
your right.
Chest X-ray, cardio.
Like,
Well, you can say when was your last
This.
EKG?
When was your last
ECG.
When was your last EKG?
Another cardio.
True false.
So you have, for cardio, you have chest pain, heart trouble,
Heart trouble, yeah.
heart
Murmurs,
palpitations, murmurs, high blood pressure,
pressure.
palpitations, dyspnea, dyspnea,
Orthopnea or edema.
edema, proximal nocturnal dyspnea. So you. Oh, I thought that was
So edema.
You missed this whole middle row.
Orthopia is having trouble breathing at night, right?
Right.
Yeah. When you lay down. When you lay down. This is with position. Alright, so that's first. So if you okay, first vascular. So have you noticed any varicose veins? Have you had any clots in your veins? Alright. Any leg complications?
Intermittent complication.
Medication, diabetic complication, blood clots, and varicose veins.
One more. Leg cramp.
Oh, the cramps. The cramps.
Okay.
Do you got the cramps?
I actually have this scraping on the back of my knee. I want you to look at.
Okay. Have you had any anemia? Any blood transfusion? Any blood transfusion reactions? Do you bleed easily? Do you bruise easily? No. So bruising.
Two P's. Petechia.
Oh, petechia and purpura.
I don't know.
Oh, they're like little purple, like,
Oh, that's the purpura.
and then petechia also.
This one, purpura is bigger than petechia.
Huh?
Petechia is just like there's small little purple specks, where purpura is just a little bit larger, greater than 3 millimeters.
I wonder if it's the same thing, but just
Same thing, just size.
Alright, so let's move on to the gastrointestinal portion. So have you had any nausea, vomiting, abdominal pain, diarrhea, constipation.
Slow it down. Nausea, vomiting, diarrhea,
constipation,
constipation. Okay.
excessive bulging, any change in your blood stools, any blood in blood stools, hemorrhoids. Did I hit them all? Most of it?
Yeah. Liver problems, gallbladder problems, jaundice. Jaundice and liver trouble are two different ones.
Yeah.
So if you get jaundice, you're gonna remember to say liver problems. That's 2 points in there. And hepatitis, dysphagia, abdominal pain, heartburn, change in appetite. So
Change in appetite.
you have to work on cardio and GI.
All right. So urinary. Let's see. Any polyuria, maturia, hematuria, urinary. So you notice any burning sensation? No, that's any burning sensation. STDs. Have you looked at that?
No, STDs is genital, burning during
burning or pain sensation during urination. Well, if it's a guy, they will ask you, have you noticed any dribbling and hesitance or any change in the stream?
Yeah.
Okay, and then if it's a girl, that's not very likely.
You're missing a big one to this. Just so you know. You keep going, I'll tell you at the end.
So genitalia, so I'm gonna do this. Male and female.
Okay.
So female, have you noticed any vaginal discharge, any itching, sores, any change in menstrual period? When was your last menarche? When was your age of menarche? If you were advanced, then when was your age of menopause? Have you noticed any change in after menopause or any bleeding between menstrual periods and any bleeding after intercourse? And then male, then any STDs, any penile sores or pain, any lumps or masses, any testicular lumps or masses. Right?
Testicular lumps or masses, yeah.
Lumps or masses.
Pain.
Okay, and then STDs.
Hernias,
Discharge.
discharge.
Discharge of hernias. Okay.
You also said STDs for male, but you didn't say STD for female. But you got
Oh,
one.
you got plus for both, right?
Yeah.
All right. So endo, then are you diabetic? Plus diabetes, including thyroid, any cold or heat intolerance?
If you have a heat intolerance, what are you gonna do? Excessive sweating.
Sweat. Okay.
And what I don't get is, okay, so thyroid trouble is the first thing, but then there's thyroid issues. Yeah. And then you also just hit it, polyuria, polydipsia, and polyphagia.
Oh, if you have Crohn's, yeah, like diabetes.
Thirstiness. Yeah.
Oh, and there's my mom.
Eating. Fascia. So fascia is eating, dipsia is thirst, and urea is because it links to metabolism. And you, so have you noticed any loss of sensations, any numbness? Numbness.
It's a major neuro problem.
Not the memory stuff. That's oh, vertigo?
No. Why would we cut the corpus callosum?
Corpus callosum.
Seizures.
Seizures.
Loss of sensation, numbness and tingling, tremors,
Tremors.
weakness, paralysis, fainting, blackouts,
Damn.
seizures. Well, a lot of them are slashed. Numbness and tingling are together, weakness, paralysis together, fainting and blackouts are together.
Seizures, tremors. Okay, MSK. So any weakness, so you have any weakness and arthritis, gout, loss of range of motion,
What?
weakness in the muscles, or the arthritis in the joints, pain, swelling, redness, location, duration, when you get when you say yes. What else to say? Loss of range of motion.
There's a lot more.
Lumps, swelling, stiffness.
Yeah.
And then the crazy portion. Have you had any of those changes? Depression.
Three more.
So depression, mood changes.
What do I have? What's my coffee set up? My anxiety.
You're depressed and anxious. Depressed, you're depressed. Are you depressed or anxious? Depression, anxiety, mood changes. There's
Attention and memory issues.
oh,
And with a minute to spare.
okay.
Okay, so a couple things I marked. For the musculoskeletal, you want to make sure you include the timing of the symptoms. So is it like worse in the morning, worse at night, worse when you're running, worse when you're sitting, pedaling? Also, the biggest one you missed in urinary was kidney stones, and that's when I came in your office for, was kidney stones. Back,
You see, that's the thing.
radiates to the front, hurts when I pee. My pee is down. It's worse when I'm not hydrated. Kidney stones didn't even ask.
But that's the thing, I'm so focused on getting this stuff.
Yeah,
I need
also
to
you
get
were
it
through, you asked all the urinary questions. So you asked like frequency, mTOR, NACTOR. Well, you asked all of those already in your pertinent pauses. Also, you skipped my provocative, what makes it worse. You asked me when is it better, and I told you when I was low hydrated. You didn't ask when it was worse.
Yeah, I said hydration.
That's when it's better. When I'm
And
low hydrated.
then you said apparently when you rest. Wrote it down.
Those are both the same.
I know. I was like, okay, what hurt? That makes it better, it makes it worse, that's fine.
Yeah, you missed that one. You missed provocative. You want to say if I use tobacco, not if I smoke, because I chewed it faithful. You didn't ask about religious affiliation.
I already did that.
Cardio you need to work on. GI you need to work on. You missed kidney stones, which brought me into your office. That's what I'm complaining of.
Good turn.
For the breath of the male,
You still ask.
Yeah.
The only thing you don't ask for male is they don't really get mammograms unless they're symptomatic.
but they don't do self-examination.
You can.
It doesn't hurt to ask.
Yeah,
You should, because men can get breast cancer.
you
And that's it during a self-examination. That's when they would find their mass, and that's when they would start getting mammograms. So if you ask the patient, even if he's male, if you ask if he does self-examination, he says yes. You would ask, okay, well, have you ever found anything that caused you to get a mammogram? All right, I'm really bad at my review systems because I don't learn things to the day after or the day before. So we'll see how this goes. Okay. Ready?
Right?
Alright. Hello, I'm Ms. Snow. I'm here to do your initial consultant today. What brings you to my office?
I have pain.
Alright, and what kind of pain would you say this is? Is it sharp pain, a dull pain?
Really sharp pain.
Sharp, okay. And where would you say that this pain is located?
It's on the right side of my belly.
Right side of your belly. Okay, how long have you had this pain? When did it start?
About 2 days already.
Okay, and does it stay in your lower belly or does it radiate?
No, I stayed there pretty much.
Stays in the same place?
Yep.
Alright, now, let's say on a scale of 1 to 10, how intense would that be for you?
It's a 7.
Okay, and what would you say your 10 was? What was the hardest pain you've ever had?
I gave birth.
Okay, so you gave birth, and this is a 7 compared to birth.
Yeah.
Awesome. Now, is this pain constant? What's the duration of the pain?
Yeah, I stayed there constantly.
Constant?
Yeah.
Are there any events that make it worse?
Yeah, when I move a lot, when I move around the whole time, yeah.
Okay, besides movement, is there anything else that makes it worse?
When I eat.
When you eat? Okay, how about anything that makes it better?
When I just rest.
When you're resting?
Yeah.
Okay. Have you had any changes in appetite?
Yeah.
Changes in appetite, okay. Have you any change in bowel movements?
Yeah, now I'm like a little bit more diarrhea.
More diarrhea? Okay, do you find yourself more thirsty?
No.
No. Okay, abdominal pain, so that could be GI, or it can be, okay, that's good enough for whatever. Have you had any past medical history? Do you have any history of diabetes, any other health issues?
Just a little bit of high blood pressure.
High blood pressure. Okay, have you had any childhood illnesses?
Yeah, I got the chicken pox, the sugars, the rubiola.
You have the sugars, so would you have diabetes? Would you pass medical history?
Yeah.
Alright.
I got the sugars.
Good.
Yep.
I think there's one more for that. Do you keep up with your health maintenance?
Yeah, I got a pap
Do you have
smear.
pap smear? Okay, so you're female.
Yeah.
Good to know. Alright, sounds good. Have you had any past surgeries before?
Yeah, I have my whole life,
Low blood was perfect. Are you allergic to any foods?
Only peanuts.
Peanuts? And what kind of reactions do you get when you do this?
My breaking heart, I pretty much passed out, like I'm about to die.
You feel like you're anaphylactic?
Yeah.
Do you carry an EpiPen?
No.
You should probably carry an EpiPen.
I think about that. If you prescribe me one, I'll probably go get one.
Okay. Do you have any medical allergies?
Yeah, penicillin.
Penicillin? Okay, what's your reaction for that?
I just get high.
Okay. How about any allergies to the environment? Do you have seasonal allergies?
No, I'm good with that.
Okay. Are you currently taking any medications right now?
Yeah, I just took like twice a day of ibuprofen for the pain. It's really painful.
Okay. And do you know the dosage of that ibuprofen?
Well, I think it was 200.
Okay. Any other medicines you should be taking, such like an EpiPen?
Not the EpiPen,
No,
but I
nothing for your allergy.
take, what's the name of the medication for the sugars?
Metformin?
Yeah.
You take metformin? Okay.
Yeah.
What's the how often do you take your metformin?
About 500 milligrams
How often?
per day.
Alright, now let's talk about your family. Do you have any siblings?
Yeah.
You have some siblings? Okay, tell me about those.
Well, I got 5 siblings.
5 siblings. Are they all boys, all brothers, all
I got
sisters?
3 brothers and 2 sisters.
Okay. And
2
is there,
older ones and 2 little ones.
do they have the sugars as well?
Only one of them.
One has the sugars, okay. And he's taking the metformin just like you? Okay, perfect. Tell me about your parents.
My parents, they are alive and healthy. None of them have the
No
sugars.
sugars?
Only one of them has hypertension.
One has hypertension. Okay, and they keep up with their meds for that too?
Yeah.
Okay, and your grandparents,
No,
are they
they're
still
dead.
living?
No, they're dead.
All 4 of them?
Yeah.
Do you know what caused them to die?
No,
Just age?
they were healthy. They were farmers, so they.
Okay, sounds good. Now, are you married?
Yeah.
Okay. Do you have children?
Yeah.
How many children do you have?
I got 4 kids.
4 children. Are you sexually active?
Oh yeah.
Alright. Are you currently in school, getting an education?
No, I have my PhD.
You have your PhD already. Okay. What's your religious affiliation?
Buddhism.
Buddhism. Okay. Do you work right now? Are you retired? What do you do with your PhD?
Yeah, I do teach at a hospital and at the university
You
too.
teach at the hospital. Okay, that's good to know. Do you have any stresses in your life?
kids, the students.
The kids? Oh, the students, not kids and students.
No, the kids are for the most part like good. Only the little ones, the ones like
The little ones, all right,
How you
does
doing?
this, do you,
HIPAA stuff.
do you ever drink? Do you
You
drink
good,
alcohol?
Yeah, I do.
Boring.
On the weekends when I go
Just clicking,
by.
just clicking. I had to do
Okay,
one
when you go out,
twice
what
too.
do you
It's when we
do?
closed the house.
Oh, really?
Two glasses because we drink a bottle.
That would have been like, what do you
Okay.
want?
That's
What?
not bad.
What do we
Alright,
actually
do
put
you
the top?
use any
Like a
tobacco?
thing at the end
Do you
that.
smoke?
Oh,
Do you
yeah.
dip? Do you chew?
I don't even like know how I'm gonna
No? Have you ever been in the military?
I don't know. I think
Yeah,
you sign up
actually,
for your
yeah,
thing
What
on.
branch?
I think it goes right to your
Right now,
blackboard.
Navy.
Oh, so you
Okay,
just
that's
sign
pretty
up.
cool.
Yeah, I think so.
You can guess on tests.
Yeah.
Yeah. You're missing two of them, and then
Don't
ask about alcohol,
disclose
ask about
anyone's
alcohol,
info.
and ask about
You gotta just put that.
Yeah, just.
Yeah.
Ever.
Do you use drugs?
Oh yeah.
What kind of drugs do you use?
I don't know if you that consider that, but I'd say some marijuana.
Okay, do you think that has to do with your changing appetite? How long have you been doing marijuana?
I've been doing it for over 5 years.
Okay, so that has nothing to do with your changing appetite. Alright,
When I get punched in the house, that she wears a pants in the house.
I don't know what else.
I'm telling you. That she beats me up in the house. That she
Oh, do you feel safe at home?
Yeah, yeah.
I need to pass that. Okay, sounds good, even though she's beating you.
Uh-huh.
So you're gay now.
There you go.
Because you're female.
There you go.
Okay, do you feel safe at home?
There you go.
And what else?
No, that's it.
Okay. Oh, that's pretty good for never studying that.
Yeah.
Okay, that sounds good. Now we're gonna go ahead and just go over your review systems, find out what's going on with it. Do you have any recent weight loss or gain? No, any fatigue, weakness? No, any vomiting, night chills, fever, sweats? Alright, have you noticed any changes in your nails, any changes in your hair? Do you have any rashes, any lumps on your skin? Do you have itchiness? Okay, for your head, do you have any recent trauma?
No.
No, okay. Do you get headaches?
Yeah.
How often?
Usually much.
During your menstrual period, okay. And where would you say that those headaches, are they located to a certain part of your head,
They
your
are
whole head?
lower. They are lower.
Okay, that sounds good. Do you wear contacts or glasses?
I do.
You do, which one? Contacts, okay. Have you noticed any acute vision loss lately? Blurry vision, any tearing, any itchiness of the eyes? Okay. For ears, do you have any earaches?
Nope.
Any discharge of the ears?
No.
Any ringing of the ears? Vertigo? Neither? You don't have any hearing loss at all?
Nope.
None of the ears bother you? Okay. Those are good for ears, I don't know what I missed.
Oh, you're good. You covered everything there.
Oh, okay. Moving on to your nose. Do you have a stuffy nose?
No.
Any running noses?
Neither.
Do you get nosebleeds?
No.
No. Are you itchiness?
No.
No itchiness. Sneezing respiratory. Are you sneezing?
Yeah.
Sneezing, itching. Okay. Sneezing, itching.
Bleeding. Running.
I said yeah, bleeding, runny nose, stuffy nose. That's it?
Yeah.
Okay. Moving on to the throat. Do you wear any dentures?
No.
No like dentures. Okay. You would say that you're happy with the condition of your teeth?
Yeah, they bleed a little bit.
You have bleeding gums?
Yeah.
Okay. Okay. Bleeding gums. Do you have any sore throats or hoarseness?
No.
No, we're okay with that. Okay, for your neck. Do you have any stiffness in your neck? Any pain?
No.
Okay. Would you say you have any lumps on your neck?
Nope.
Any masses? Any
Nope.
skin changes? Okay. On your breasts, have you noticed any skin changes on your breasts?
No.
Any masses or lumps you can feel?
No.
Do you have any discharge from your nipples? Do you practice self-examination?
Yeah.
Okay. No changes in your exams recently?
No.
When was your last mammogram?
I actually that's
Last month. Oh, perfect. Keeping up with us. That's good. All right. Are you having any coughing?
Nope.
No. Do you have any sputum or any mucus discharge?
Nope.
No. Okay. Coughing. Do you have any shortness of breath?
No.
Dyspnea?
No.
What's the one when you're laying down? Orthopenia?
No.
Do you have any coughing up blood?
Nope.
Um,
You got asthma.
Asthma, any history of asthma, any history of TB, any pneumonia?
Right here, practice history with Sam. What's up? Where you at? Yeah, where you at? Okay, I'll see you.
Okay, are you having any chest pain?
Nope.
Any heart troubles?
Nope.
Any palpitations or beatings?
Yeah, I got no competition.
Palpitations? Okay, do you have any heart murmurs or history of heart murmurs?
Nope.
Are you having high blood pressure?
Nope.
No? Okay, do you have heart trouble, chest pain, palpitations, murmurs? When was your last ECG?
Last one.
Okay, and did you get the results for that? Did everything was normal?
No, I haven't got that.
No. Okay. Let's go on to urinary. Are you having any changes in the frequency of how often you pee?
No.
No. Are you having polyuria?
No.
Hemuria?
No.
Okay. And do you feel like you're peeing more at night?
No.
No. Any burning while you pee?
No.
No. Any blood in your pee?
No.
I asked that already. Do you have any kidney stones? I think it's your kidney stones.
But I'm a male now.
Oh, okay. Now you're a male also.
Yeah.
Okay. Do you have any dribbling?
I'm not for that. No.
No dribbling? Any hesitancy?
Nope.
Have you noticed any inconsistencies in your pee?
No.
Do you feel like the force of your urine is down?
Nope. Good.
Okay. Let's go on to genital. Have you had any penile discharge?
No.
Penile sores?
No.
Pain?
No.
Any testicular pain? Any testicular lumps?
No.
No. Okay. Have you ever had an STD and history of STDs?
No.
No.
Good.
Okay.
Male.
Let's do female.
Yep.
Okay. At what age did you first get your period?
15.
Would you say your period's regular?
Yeah.
Okay. Do you notice any bleeding between periods?
No.
Any bleeding after sex?
No.
Have you reached the age of menopause?
Yeah.
Okay. Do you notice any postmenopausal symptoms?
Yeah, I get hot flashes.
Hot flashes. Okay. Are you having any postmenopausal bleeding?
Just a little bit.
Okay. And around what age did you hit menopause?
52.
Are you having any vaginal discharge? Any itching? Any sores? No cross stomach? All right. Sounds
One
good.
more. Okay, go ahead. Everybody has it. You're having
STDs.
sex. There you go.
Okay. Let's go to peripheral. Have you noticed any varicose veins?
No.
Do you have any history of blood clots?
No.
Any leg cramps?
No.
No. Okay. And you having any intermittent claudication?
No.
On to endo. Have you had any thyroid problems recently? Is your diabetes acting up?
No.
You're okay with that? Don't have any polyuria, dyspnea,
That's good.
alopecia?
No.
No.
You're good.
Okay. There's one more, right? Heat or cold intolerance?
Yeah,
Excessive. Okay. Hematology. Do you have any history of anemia? Any bruising, any bleeding?
No.
Okay.
What has to be given to society?
Have you ever had a past transfusion? Is that it?
Yeah. You got fatigue for problem. You give me 4, so that's good.
Okay. On to neuro. Are you having any seizures?
No.
Any blackouts? Any fainting?
No.
No. Do you have any weakness or paralysis? Do you tremors?
No.
There's another two ones.
No. Sensation. No.
Oh,
Things
loss
like
of
other things like
tingling. Any loss of sensation? Any tingling? Psychiatric.
Yeah, you get like a
Do you have any changes in mood?
Do you have to pay to
No.
print?
Makes sense. You have it on your
Okay.
card.
Do you have any
You charge
anxiety?
with dollars.
Depression?
You don't need it.
Do you
Dude, I don't stay
is there
here
any
ever.
depression?
You have $75 a month right now. Semester.
Is there any depression?
You just like swipe your little card.
Yeah.
You just type in your thing or.
You all the time and I say, hey, Sam, I have a question. I didn't remember what.
Memory issues.
Okay.
Okay, on to musculoskeletal, which I skipped. Are you having any muscle weakness? Any muscle pain?
No.
Any joint weakness, joint pain?
Yeah.
Okay, is there swelling of the joint?
Yeah, a little bit.
Can you tell me which joint it is?
This, the shoulder. Right
Your shoulder joint, okay. Does it stay in the shoulder? Does it radiate?
Stays in the shoulder.
Stays in the shoulder. Redness and swelling.
Yeah.
Is it tender to touch?
Yeah.
Okay. What would you say the intensity of that pain is?
It's 4.
Okay. I don't know.
What?
Oh, are you stiff? Any stiffness?
And what else? I can only do this.
Ease the range of motion.
There you go. Good. You agree with that?
Last one is going to be GI.
All right.
So you have any changes in appetite?
Yes.
You already said that. Any change in thirst?
No.
Poly what?
Polydipsia.
Polydipsia. Okay. Are you having any jaundice?
No.
Any liver or gall problems?
No.
Gallbladder problems?
It's a typical
Gallbladder. It's a good thing to remember. I'm gonna ask my patients. Gallbladder problems.
You can say
Hepatitis.
give me the confirmation.
Any irregular bowel movements? Any constipation?
Yes.
You said you have
Yes.
diarrhea. Vomiting, nausea.
Yeah, I do.
Constipation, diarrhea, excessive belching.
Yeah.
Any excessive gas.
Pretty much all right. Then on the, so if you ask me if I have headaches, and I say yes, then you're gonna say nausea or vomiting. That's the only thing I use. But everything else is good. Oh, you got it. We got it.
I'm gonna work on my cardio possibly. If you give me abdominal pain, that can be GI.
Yeah, or
Endocrine.
it does, yeah, it's everywhere. Like, I mean, like, mine was like trying to point like, so, but if it's like upper, like if it's in the middle, it could be GI, upper, or it could be chest. So, yeah. Kidney, if it's in the back, or it could be that muscle, skeletal, the back is there too. But that's the thing that it's also more of next semester, even that, and then I now we're just looking at what we need to get. That's what we're looking at. Stay here.
I was gonna go downstairs.
Get on.
Nick, you ready?
Yeah.
You after me?
Yeah.
So let me know how it goes.
I don't think it's gonna be too bad.
I don't think it's gonna be bad.
I heard that she goes really slow, bro.
She does.
I don't know.
For this, how could you, what, like answering questions was?
Yeah, like she'd be like, yeah. Keep trying to like, so I get out the bed because it'll be tight if she does that.
Yeah. Although that hesitation might be able to let you like in your head, like, all right, I'm not listening to your answer.
Yeah, I'm not gonna listen.
What am I asking next?
Answer me yes or no. Boom, 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 boom.
Just
I
nail
think
it.
you should, like, pay attention to some answers. Sorry, dude.
Well, yeah.
If it's like important.
No, yeah.
Garage door.
Yeah.
For the most part.
Yeah,
No.
for the person to be positive and negative. All we're supposed to do is like jump to the review system. What we feel would be like most closely related to your science. Condition of teeth. How do you word that? Because it's supposed to be yes or no.
I don't know.
Condition of teeth. Yes. Condition of teeth. No. Wait. I know the first one kind of like skipping over
I'm
it.
just gonna be like, have you been up to date on your dental exams?
Do you brush, floss, and rinse?
Do you floss? No, no one.
I floss.
Too.
Like, I leave my teeth in
I
my
floss 5 times a day. Thank you very much.
How much floss do you go through?
I'm just kidding.
Floss is expensive too.
Yeah, it is.
They should make it cheaper. They want people to
Especially
floss.
because I don't like using the floss. So I
Using
always
picks.
feel like, yeah, buy those little things. They're always way
Those
more
are
money.
No, and I have to buy the freaking threaders with my retainer, so it's like another thing I have to buy. What's this app on this thing? Get off my damn desktop, man. No more Ackland.
Yeah. That creepy ass. I have to go to the bathroom. Oh my gosh, do you think I have time to go to the bathroom?
Yeah, don't run.
Bring my pen with me. Do I go to her office?
I don't know.
Do we like call? Get back there?
I don't know.
Send me an answer?
They don't come get us.
Oh.
I don't know, like, maybe just like engage.
Fuck, I gotta start memorizing Euro. How are the reindeers doing today, John? How are your reindeers doing?
Oh, they're doing great. I'm never gonna be able to forget, so. My leg.
Mm-hmm. Don't you go right now? I mean, I don't know.
You just remove your foot. Right. Oh. Hi.
Three something.
You have that pretty well?
No.
You'll be fine.
I mean, I did okay on it. I did it this morning to myself, just write down questions.
You got this, Bob. What time you got?
3 something.
Okay, you got time.
You?
2:40.
2:40?
2:40.
For your,
That's it.
yeah, I think I go 2 after you.
Yeah. That's pretty good. I hear she's fair.
Oh, yeah, yeah. Oh, are you gonna cry since it's Tom Brady and fantasy?
No, I don't even want it.
Oh, okay.
Spend it for you, man.
Yeah. I try not to drive Patriots players just because it ruins how I watch the game. What are Allie's going on her little?
What time we have med imaging at 8:30 on Wednesday? 8:30. No,
You're talking about the fine.
Yeah.
Fine.
Yes, sorry.
Yeah, Wednesday,
I'm at
8:30, I think.
Just like our other cats.
Has anybody else not looked at it?
What?
I'm not looking at it.
I'm not looking at it since Tuesday.
What? Really? I never looked at it yet. But I'll play with it this weekend.
Good. How about you? I'm glad you showed us those things.
Yeah.
That was nice.
Everything was like, I
Mm.
just tried that and I'm like,
Yeah.
it's a lazy thing.
It is. Yeah, he said that in his lecture.
What was the gastromental?
Yeah, that's the same as before.
Is that when we're showing you?
Wednesday at 12.
We did, because we did
I wanted to turn
cards.
around.
I did more ink.
I need to see if there's anything
The
later.
Quinn, I was gonna turn around and listen.
So I did
And then I did
that last night to
And then I
study.
didn't get that
And
question
then
on the
when we were
test.
together, but she looked at the PowerPoint and found a couple of slides that weren't in ink. So,
That's what I was like, that's what I thought it would have been. I was like, why is that? But how was
should
supposed
be
to
able to make it there right away. Maybe how much of it is without dental insurance as well, just for.
Yeah.
Yeah, but I don't know. Yeah. I just, because I eliminated the rest of them. That was one option.
I just don't remember seeing that one. So I was like, this is fake. I thought that was the one. So I said like pancreatic too, I don't know why I said that.
all right.
Anyways, it's over. We got it.
Does he put grades on it?
No.
Did you get that one?
It's not done for it.
This is actually the first time. The second time.
Oh.
And that's just for the people, correct?
Do you want to play tomorrow?
Oh, right.
I mean, out of here.
My pancreas around there.
She went, sorry. If she's not back up here at like 2:30.
I mean, I go, I mean, runs on the weekends.
Oh, did Jake already go? Should be ready.
Oh, because it's by the momentum. God damn it.
But it's like,
Yeah, that's what I said.
I knew I could work on the grain.
Yeah, I definitely, that's why I was like,
He makes the most of it. That's the other one.
The audio that makes sense.
Maybe so.
it's tricky. The one you showed me.
Yeah, that one pissed me off.
The mega burger, it was actual weight. And now,
What happens if you fail, like,
that's what it's supposed to be.
I mean, I just knew it wasn't any of the other ones.
It was really supposed to be like out of arcade or something.
Yeah.
Not even that.
Yeah.
Started to act like.
I kind of just kind of.
We should
Protest?
fight it. I think if enough people get it wrong, we might just throw it in.
But I think a lot of people are right, it's just from classes of elimination.
Yeah.
But it wasn't on there. I mean, I don't know where that came from.
We should tell them.
I'm not gonna be the one.
I'll be that one. Why does no one want to be the one? This is not the first time it's There was another, he probably gave it to us already.
The one with the, like, there was two answers or something?
The one that he cut us off at slide 48, but put a question from slide 52. From
Oh, from
thorax.
48,
It's like dilation and constriction of the bed of the bronchial.
Oh, that was from another test, from another section.
That's from this final now. But he probably gave us those points anyways.
Because they adjusted it.
Yeah, so that's why I just decided not to even waste time. All right.
Sorry? 355.
Oh, wow, that's late.
It might.
Are you gonna stay here?
Probably.
Hey, Bob. I have a super weird question. I know.
Super rude question.
Weird.
Do I have a? Oh, weird. I thought you said rude. I'm like, well, I might have a weird answer for you to say.
No,
What do you
no,
got? What do you need?
I know that if you fail a test, you have to meet with your advisor. I've never failed a test, so I don't know how that works. What happens if you fail like the final? It's just another test, but we're on break. Semester's over. You're still meeting with your advisor?
I can only imagine that you would have to when you get back. Apparently, when this happens, you get a letter.
Yeah.
And then you have so many days to get back to them. I would imagine that you would have to do it when you get back. You know, I don't think they're gonna make you.
Because all I need literally is like a 40 to pass the class. So I kind of want to just practice that in detail and not just worry about that.
What are you talking about? This?
Anatomy and phys. Anatomy, I need a 43, and then for phys, I need a 36. That's to get an B. So even just a pass, I get a 76. Times 5 minus the 91, 92, 84. I need a 33 on my anatomy test to pass the class.
And you made your quizzes
Into a test grade.
to a test grade, and you know what you got.
Yeah.
On the third.
Yeah, they're close.
Oh, shit.
So, yeah, what I did was,
Well,
yeah.
so
I got 3 on the 91.
Let's take a look.
You need like a 3.
I need a 33.
No.
No, yes, to get a,
To get a
76. 76 times 5 minus 91, that's 92, minus 84, minus 33.
Missed two, motherfucker. Oh no. I missed one, yes.
So you said 75. You really don't need 75.
Missed that broad ligament. I knew it. It's confusing with round ligament. What's this fucking picture? You could have better picture.
That's how we all do.
Throw pictures, throw people off. I deserve 100.
Dude, I watched those the female reproductive
What I would
3,
compare
4
it
times just to get it.
is
Because you're creepy.
What's that? I mean, just because they all look the same.
Yeah, they do.
You're welcome.
Well,
And that's not a weird question.
Oh, we cannot see them. We just see that what we missed, but we cannot see the pictures. We cannot see the ones we missed. I know which one I missed, but I just wanted to see it.
No.
Oh,
You should just let it be available.
yeah.
There's no like.
Pinky reuses. Yeah.
You think so? So he doesn't have to do extra work?
I think so, too. So, I can really mess up the anatomy.
Not quite as high grade as this, but
So he uses that. He uses all the three acorns as one, like the one going from the test.
yes. Yep. You go to Miami? You don't go to Miami. So your kids are here. So that oh, they will be driving. Yeah, so I think she and another teacher are focusing on like did you get out any books? I see you writing books.
I did not finish.
No. No, I haven't even looked. What did you forget? Really? Yeah. Fire. Do it. Yeah. Well,
There was some stuff on eBay. Like they're like 50% off of where it was coming from, but Thailand. And it was like numbering how the pictures is staying on Thailand.
That could be
Like international.
international edition.
I just don't know how different they are.
They're the same.
Yeah. There's a bunch on eBay like that.
Okay.
Cost like $180 on eBay.
Perfect. That's what I'm gonna get.
But the number that we were.
That is the end.
But it's such a nice edition, whatever. The micro book's the most expensive one.
Alright, those are already.
Most of my kids, I'd say. It's that weird age
Well, I uploaded some too. Jeffrey uploaded some, I uploaded some, and I got the, from AP students, we got the, got the parents. Put uploaded too. For next semester, for OSCs. For the, no.
So I took what you said yesterday, we went over the luck, and I I felt like this was so much more organized than looking it over again. You know, just like, yeah. I know that I feel it.
Is that for the neuro exam? Great. They're round and building. I wish they had told them, but it wasn't.
Oh, I'm going.
Yeah, no, there was a, severe.
Yeah, I think, yeah. Whatever, I don't care.
It wasn't great.
Yeah. Is this your clipboard or clipboard? Yeah. Can I just take this back to take the picture? I'll be right back.
Where do we go for the HIPAA thing? Or do we gotta go on Blackboard? Oh.
Did you see it? There's 3 different folders we have to do. I don't know if you study well. I've never used it. I haven't used textbook yet this semester, so I don't know.
I can't. I'm tired.
Yeah. I go tomorrow.
Is there a test at the end of it?
The quiz grade.
Oh, it is? Yes.
What'd you say?
Wait, is there a quiz at the end of HIPAA?
Yeah, there's 3. One at the end of each section.
Oops. Oh my god, this is gonna take all damn day. Doesn't the hospital make us do this anyways before we go to clinicals? Doesn't the hospital make us do this anyways before we go to rotations?
I have no idea. They probably do, but Nova has to do it as well. They already covered, they're a hybrid entity.
Put down for the Google Drive. Still studying,
Well,
What?
I'm emailing everyone about Friday. Oh, we have our cultural presentations Friday. Sending it really good. I think I told you. Did I? About 8 o'clock? Yeah. Zoom's open, 9 o'clock, we will present.
So we don't have class?
No. The thing starts at 10, have your board up and ready to go.
So, which grade is that? Which grade are you?
Hey Cody. What's grades are up? Hey John Baylor.
Oh, still a minute.
Oh, okay. That was sometimes the valuable.
That's the way I look at it now. It's not all of them.
Oh.
She was, like, aside from I forgot to ask.
This is Casey.
There's one at 45.
Okay.
She said for
Messy.
what she said. She said the woman counted it. I'm typing.
Oh.
And then there's like I think I forgot to ask like siblings ranch. I didn't ask the sibling ages. So I should have asked. And then the mom.
Hey, how's Anderson?
It wasn't bad. She's had I just went through the whole Florida, and then I just went through like.
What's the name on it? Really?
She would tell you.
Get it started. Get it started.
Yeah, she went through it pretty quick.
Yes, so stupid. What's the
How long do you have to write it down?
I mean, it only takes you like 30 seconds.
She's like, all right, there's like,
I don't have a PC. And then when I went through it, checked it off. Yeah, well, no, I just asked. When was the date of your first period? I was like, have your regular frequency, flow?
But he didn't actually four goes on the
I asked her if did she help you find out how many nipples? Initially she was. It's like she had to kind of. It's just at her desk. That's where my pen.
Well, it's just like, did she give you the piece of paper?
Should I let you write?
Yeah. I just wrote like the outline.
Yeah, like the letter.
That's all I need, I just the one.
Oh, yeah.
I'll probably go.
I forget, I got the one that was just like I went through it all. Yeah, I forgot this like this.
I already went through it already, but I'm about to. You read this? You read what? No, I'm about to.
I can have the your 16 is like one, like I'm looking for like one.
Practice. Urinary.
frequency? Did you get like the any
Video index and
fill
And then first she said she had cough. Oh, first she said she had a cold, and then she added a cough in there. So then I was like, how bad? That's gotta go to respiratory. So I kind of did like 3 things in that, but I guess she didn't count the
So what was the main?
Oh, what was her fatigue? It was hard.
Was it?
Well, I was like, how do you describe your fatigue? How tired you are?
Like your character, you asked the character.
I know. Like, is it unbearable? Do you have to go lay down? I don't know. Or can you keep functioning? That's kind of what I asked. And then I said, is it in your body? Your body's fatigued? Or your head? I don't know. It was kind of weird. Like, you had to think about it. Not just pain. Practice fatigue.
L4 is like crossing the so L2 goes like L3
Good?
Yeah.
Did
I was really scared because like, it's her class.
She was cool?
I don't say anything.
Did you write something down?
Yeah. Are you going?
Yeah.
So
I just like
Count.
because when they're talking, like when they're complaining, it's wrong. I'll like circle the L4. It's not a system, so I cross it out.
Stop doing it right now.
The whole.
Yeah.
Well, like one time I was just sitting on
You went already, guys?
No, when I was practicing.
Oh, when I was doing it, then it's like, but she'll like, if you say, she'll be like, pull your notes,
I think so.
and then like finish it.
What did you?
I said, is it like unbearable to have to get down right away?
You better start this. It's pretty long.
I know, isn't it an hour?
In the first section. Yeah, 20 minutes.
You want to take a test?
Oh, there's all we worried about right now.
What? No.
We don't have stammer tests in the next 7 days or anything.
Why do babies like to put their feet in their mouth? Yeah, I'm done with that. Can you like pause the HIPAA? Or do you have to do it all in one sitting?
You can pause it. You do that one session. It's like 20 minutes, 5 minutes.
Okay, thanks.
So she goes, she's like,
Oh, that's history.
Rogers. Alright, cool.
Was the sign on the door?
Yes. I just didn't read it clearly.
There was no sign anywhere, and she was like coming down the ceiling tile and was like, shh, I'm testing, and we were not even noticing.
There's been worse things happen while people are testing.
There was. Now we're gonna skip and then bring your hours. Because also C5, C6. So C5, C6, C5, C6. So it's 7, 6, and 7, the card.
Are you doing hip hop?
Hmm?
Hip hop?
Yeah.
Yeah, I forgot about that.
Oh, you have your.
Now, so the teller says, all right, the teller